insert witty banter here.
When you say
Classic.
that, you just
Kills.
Yeah, it's
kills the
over.
flow of the
you
conversation.
dissolve all possibility of witty banter.
Yeah, I just want to make sure that our intros are as horribly boring
Well, I
as
gotta keep it
possible.
because you wouldn't want anybody to make it past the intro. Like,
Exactly.
the intro's there to weed out the weak, which is everyone other than us.
That's why we just broadcast into the void.
Exactly.
All right, and we are live. So today we're going to be taking a look at consumer health, specifically the burgeoning field of wearable biomedical devices. So stuff like Fitbit, Apple Watch, all sorts of things, blood glucose monitors, heart rate monitors, the whole 9 yards. So, Hubbards, do you want to kick us off?
Yeah, I guess I can just elaborate on what you're introducing because you covered most of them. I think even if you look at the data, the most likely wearable or health related wearable that people are going to know is like a watch, and probably Apple Watch because they're like the
The
number
one and only.
But yeah, so and I think mostly started off just with like activity trackers essentially. You had like Fitbits that would track your steps, basically, how many steps you're taking and
The old
monitor your-
pedometer, if you want to be scientific about it.
Yeah, and I think some of them are also like GPS, so they could like track out your running route and figure out where you ran and that kind of thing. And then they've just started integrating more and more functionality and sensors into like the watches because it's obviously touching your skin. So there's a few kind of obvious ones that they can work in there without much effort. And like the newest Apple Watch, I think it has an ECG monitor. It has your heart rate. It has temperature. And then it has like activity level and sleep monitoring, so you can wear it overnight. And I think that's about all that it has. But like again, that's like it also has blood oxygen levels. So which is actually something people started paying attention to with COVID.
Yeah, it got quite interesting in COVID where some people could tell that they had COVID with no symptoms because of their blood oxygen level dropping. So technically, you could almost say that's a symptom, but you wouldn't have known it if you didn't have these blood oxygen monitors.
Yeah, and then there are some other. So if you go and look at the numbers, like watches basically account as of right now, basically are like the wearable market is. I think it's like over 60% of wearables are watches, smartwatches of some form or another. But you do have other kind of smaller categories. You have like rings, which are basically exactly the same, just smaller, different form factor. And
the interesting thing with rings that I saw that apparently gives them quite a bit of an advantage is that they're closer to the blood vessels in your finger than the watch is to blood vessels from your wrist, so that they can more easily see into the blood vessels with sensors.
Well, that's definitely an advantage. From a technical standpoint, the advantage I see in rings is just like way more convenient to keep on 24/7. Like if you have a environmentally resilient ring, it's like a wedding ring or wedding band or whatever. Like you can wear it pretty much nonstop with few exceptions, right? Like there's
The only thing that I would seem to think would be kind of annoying is like if you're lifting and you want to monitor yourself, like monitor your exercise, but you have the ring could actually interfere with that, so you'd have to swap over to something else. Like I can't.
I guess it depends on what exercise, but I think for many people, a ring would be better than a watch. Would be my guess.
Yeah,
But
depending.
again, it
Like
does.
if you're jogging or something, it's fine. But like if you're doing deadlifts
It depends
or
on
something.
your
One
particular-
interesting, not quite a watch one that I saw, I think it's Whoop maybe, and it's basically just a large band that goes around your wrist, so it wouldn't be as cumbersome as a watch because it doesn't have a distinct face. But
And there's also like patches essentially that are becoming used as well, which and that goes into some of the other devices. Like the other device that has been around for a while now and it's just becoming more like used is continuous glucose monitors, uh, which started off like for diabetics, obviously, because they need to monitor their glucose instead of pricking themselves every, I don't know what the schedule is for a diabetic, but on regular intervals, diabetics would have to just, well, the convenient way that they got it to was like just pricking your finger with a blood to get a blood sample and then running the numbers. And now you can just like get a little like patch, and it, as far as I understand, like the ones that I've seen, it's like a little almost wire that goes into the subcutaneous, like it's supposed to go into like the, I think, subcutaneous fat area with the liquid and just like sit there, and it's like this little wire and it monitors your glucose levels continuously, and you can get like a readout every minute.
yeah, there can be a few issues with those that I saw where if you have poor health and other factors like low hydration, for example, then it can cause an issue with your subcutaneous fat being able to transfer the information on your blood glucose levels. But for the vast majority of people, and especially healthy individuals, it's a good way of monitoring blood glucose.
Yeah, so it's another device. There's also blood pressure monitors like that. They're not continuous and they're not really wearables in the same sense because they're not, you don't wear them throughout the day. Although I think there are some that are, I think there are some efforts to put blood pressure in a more consistent measurable state, but like the ones I've seen that are commercially or consumer available are just like set up devices that you put around your either wrist or upper arm like you would at a hospital or doctor's office, but they're just home devices and they're like very affordable now, like $100, $150 for blood pressure testing at home. And then not really wearables, but in the vein of like consumer health stuff that is available. Uh, the two other interesting ones that are currently available are like blood panels or blood tests that you can get, and DNA tests, uh, which those are kind of self evident. But there's more and more. I guess the thing that's changing is like how much is being measured, both in
Yeah.
terms of like for blood, it's like what they're adding more and more things to monitor, and some of those things are just like there's a lot of research and advancement going on in detecting cancer in the blood. So biomarkers that will point towards certain cancers are being discovered and tested, and so like more and more things are being able to be tested in your blood. So like it used to be not very useful maybe to get a blood test. Now it's getting more and more useful as more and more things are able to be screened for. And then with DNA,
Well, that was the
uh,
promise of Theranos, right?
I I didn't follow
Well, that was like
the
you
scam.
test your blood, and then everything you can test for like all like you just need one blood sample and you can test for like tons of different stuff. That was like kind of the
That's why
Amount.
it was like a good scam, right? Because it was plausible. It's
yeah.
like they had all these advancements in blood testing, and then yeah, then it's like, well, I've come up with the one blood test to rule them all. Bow down. Uh, and
Give me
the
money.
DNA testing is also kind of similar, where they're testing more of your genome, depending. Like before, a lot of the time they would just do like scatter testing. They would test just specific sites, but now there are certain companies offering full genome decodings and like uploading your entire, and they'll like actually upload and analyze your entire genome, and then they'll, I mean, what we can get into more details later, but so like the amount of your genetic code that's actually being analyzed is expanding, and but also like all the scientific literature to like come up with any useful kind of analysis is also expanding rapidly. Like genetics is essentially in its infancy still. So there's like
Mhm.
studies published every month that have implications for DNA and health linkage. So that I think that covers more or less like
Well, there's
I
one borderline theoretical. It is practice right now, but it's not as well established as blood panel DNA, and that's a microbiome testing. And how they get a sample of the microbiome in your gut, I'll leave to your imagination, and then you mail it in, and they'll do DNA sampling on that, which has benefited from all the decreased
well,
costs of DNA.
to be fair, we shouldn't leave it to the imagination because people are retarded. It's your
Oh
shit.
yeah, true. You take a shit in a bag and you mail it in, and like right now there is not strong efficacy for it, but as with the human DNA, sequencing bacterial DNA is changing on a monthly basis and becoming more advanced. So that also has potential in the same vein as the DNA testing.
I guess the last one to mention that I think is like questionable whether it's like health, but is Neuralink. I guess depending on your situation,
Mm-hmm.
might be very health beneficial, but the they just I
It's a
think
little bit more
you know
involved.
well, and it's not like there's actually zero working
Yeah, it's just in
examples.
monkeys and
They
pigs at the moment.
Well, I think they did just do the a recent. I think they did their first human trial, and they are trying to get FDA approval this year or 2023, I guess, because they just had an update like in the last couple of weeks. So they are moving ahead, but again, it's not like there's an actual purchasable product of any shape or form. So it's kind of more of like concept stage, which
Mm-hmm.
given the track record of a lot of prototyping and concept stage stuff. It's 50-50 on whether it'll ever make it mass market. But I mean, it is worth noting that that's on the horizon, likely
Yeah.
in the same kind of next decade or two, if they get everything working. So that, yeah, I think that's like covers essentially what there is available. You guys have any thoughts, or do you want to? I mean, we can. I think the next thing is just we already touched on it, but like how effective these things are at the current moment.
Yeah, that's probably the good field to go into.
Well, I'll
Yeah,
just
if you want
throw
to just
in
kick it off with what you guys found.
yeah. I think I was talking about the continuous glucose monitors, and as far as I can tell, they've only really studied the efficacy for diabetics because obviously everyone has blood glucose levels that affect their health. But with diabetics, it's very important and key to them not dropping dead. And that's why, I mean, that's the whole reason that the device was pioneered was for them. And so they've actually done more like several studies on like if it's more effective than traditional methods of getting uh, blood glucose levels. And most of the studies that I saw showed like small but statistically significant benefits to using a continuous monitor versus standard methods of monitoring. Uh, just and basically like the outcomes they would measure were glycemic control, which is what they're trying to achieve with for diabetics. That's like what they're trying to achieve. So that's pretty an important outcome metric. Uh, and yeah, it does seem to help, which I mean makes sense to me that the better you're able to monitor it, the more up to date your information, the easier it is to exert control over that particular metric. So I don't think it's that surprising of a finding, but it is useful to have that because you could also see a world where it's just people don't care enough to monitor. Like just because they have the additional information doesn't mean they'll use it. So it is interesting to note that it does seem that at least some of the participants do end up using that information to gain further control over their glucose levels.
I think on a personal level, I'm interested in looking into this sort of glucose monitoring because I don't know if it's a common term, but in my circles, a lot of people refer to things as being like, oh, low blood sugar, I need to eat kind of thing. And just to actually have the stats, the data as to whether that at low blood sugar is actually influencing your mood or if you have low blood sugar at all would just be interesting. And potentially, if it was causing things to happen, change your behavior.
Yeah, I think that brings up like an interesting point because I think one of the key issues with these like home monitoring devices is like how like just because you can collect the data doesn't mean you can do anything useful with it. And I think that's like further complicated by like you're going to have lay people with no medical backgrounds just given a bunch of essentially medical information about themselves, and then what choices they make in the face of that information will be interesting because I think the hope, right, is that you give people more information and then therefore they make better choices, which leads to better health outcomes. That's like the logic. But if people don't have like the knowledge base to actually glean any insight out of all this information coming at them, then it's all for naught. It's just basically noise to them.
I can already see the TikTok trend of trying to hit super low blood glucose levels to cause yourself to trip out among minors. That's definitely going to happen.
Oh, and you can see dumb shit. You can see that being like one of the extremes of people like just essentially misusing it. But you can also just see like people being like, oh, well, I got a spike of glucose after I ate such and such food. Therefore, that food's bad. It's like, no, that's the reason that you go to medical school is because you need the actual training to be able to interpret these kinds of things in context. And maybe from a medical doctor's perspective, a spike in your glucose after that particular meal, that spike is totally within parameters and you're not doing any harm to yourself whatsoever by having that food. And now you've just like, cut that food out of your life arbitrarily because your, uneducated opinion decided that spikes like that are just look bad on the graph and therefore you don't want them anymore.
Yeah, that was one of the big flags that when I was doing the research that people had noted. It's just like getting obsessed over the metrics and then optimizing things that they shouldn't and then damaging other parts of their health because they're just trying to optimize for one or they don't understand it properly. And yeah, I could absolutely see that becoming a problem.
Humans obsessing over nutrient? No.
Stressing about stuff that is like completely like arbitrary and not impactful on their health. Yeah, it's like a huge waste of time. And I think like for some things like that goes to the next device that actually has some reasonable amount of evidence behind it, which is the activity trackers. And I found like several meta-analyses that had a couple dozen studies in both, I think, although there's probably some overlap. And both of the meta-analyses found a moderate but meaningful increase in activity for people that were using them, which amounted to they were using steps taken in a day, basically, as the proxy for activity. And it was 1,800 steps about for both studies, which is actually, given how much people walk and how like the noted benefits of walking is actually impactful and would probably make a net benefit in people's lives. So that is interesting that,
Well, the data I saw, the correlational data on mortality was that an extra 1,000 steps per day, which these people are achieving with their walker, even with a huge, or their monitor, even with a huge margin of error, reduces mortality by between 6 and 36%, depending on how sedentary you are. So even someone who's healthy in that case would be reducing their mortality rate by roughly 6%. And someone who's particularly unhealthy could be as much as 36% of a mortality rate reduction by getting that sort of stepping in a day.
Yeah, so I think
Yeah, and I saw the
could,
same impacts, or not the same, but I saw positive impacts when I was looking at physical activity interventions for treating obesity in children and adolescents. I looked at a meta-analysis that checked out 12 studies, and with about 3.2 thousand participants, and they found that generally speaking, just having the feedback did assist the kids in that group, the one with the feedback device, in achieving some decreases in their total BMI and body fat, which, especially for children, that there is some evidence that suggests being obese as a child makes it a bit harder to lose weight when you're older. And so it's kind of like the same idea with smoking. If you start young, it's just worse off. And so at least from this meta-analysis, that's a encouraging result.
Well, it makes so much sense. You think of kids and their ability to understand what's going on with their bodies, pretty much nothing. But I mean, they can read a graph and say it gives them a healthy parameter and where they should be. Like kids would need even more hand holding than adults, but it would be more of a difference between them using it and them not having it, I'd imagine.
yeah, and I was just gonna kind of add in there that I think that is why you the blood panels that some companies have started, where they will test your blood and they'll for a bunch of different things, a bunch of different biomarkers and like testosterone and other hormones and vitamin levels, all this sorts of stuff. I think the all-in-one solution where they do not just the testing but also the analytics side of thing will be the more kind of popular preferred way to go with a lot of these devices, where they're pairing the analytics with the actual tests and the actual data collection. And you do see that with stuff like Apple Health, where you subscribe to Apple Health and it gives you recommendations and workouts and all this sorts of things. And it just gives them, from a business perspective, obviously it makes sense to them because they want continual revenue. And if they can sell you on a prescription for whatever follow-up intervention, or they can sell you on a subscription for a health food or just the analytic software or the analytic information, blah blah blah, it's just a way to generate further revenue. And then I guess it does help the average person who doesn't want to spend the time and effort trying to sift through the information and come up with actionable line items to do in their lives with the newfound information. If you just have an app that spits out try these 3 things and then evaluate your levels in 6 months, it just simplifies it a lot, which I think for most people is going to be worth the money.
I can already picture my Amazon homepage having a recommended groceries for your fitness plan or your dietary goals, informed by my Apple Watch.
Your genetic heritage.
Yeah.
Oh, if you have an Apple Watch, Amazon ain't gonna recommend you shit. They're gonna tell you to die.
No, I'm seeing in the future here. They're gonna work together to defeat the big bad of Alphabet.
It's gonna be the corporation wars, but I think that is, in my mind, the sensible future, I guess, for these things, where you're pairing the actual device with some sort of analytics and you're not just giving people. I think it's fine to give people the information, but for most people to have the option to just get some quick and easy actionable steps along with it, it's just obviously going to make it way more accessible and useful to their everyday lives. And just, here's the data, figure it out.
is also, I think, going to cut into or cut down on the amount of false starts and incorrect directions people pursue when trying to deal with problems that are more nebulous. The obvious example I have is I remember being taught by a psychology professor who, her practice with dealing with anxiety patients, would recommend a blood test to check their thyroid levels. And she said a good chunk of the time, like, 30% of the time, the person's thyroid's out of whack. I was like, well, you can do a lot in therapy, but if your thyroid is pumping out hormones like crazy, like that's just a problem you have to deal with medically. And in this case, if you're having mood swings or something like that, and you can approach your other health metrics and look at your diet and your glycemic index and your activity levels and your sleep, then maybe you don't need to go to a therapist. Maybe going to a therapist wouldn't have helped as much as you think it would because your problems were all physical. There could be a decrease in that sort of searching randomly for what the cause is. You could start narrowing things down in a more logical progression.
Yeah, I think there will be a ton of room for like triangulating various health conditions, right? I think you're going to also just see people recognize patterns and conditions and diseases and deficiencies and various things that were just never recognized before because they'll have so much data to throw at it.
One of the really interesting ones that sounds too good to be true was an attempt to correlate the speed at which someone's finger swiped on their phone with the onset of dementia in the elderly. And as far as I could tell, that study didn't result in a statistically significant effect. But that's the sort of idea that, a kind of off the wall idea that could actually mean something given enough data.
Yeah, I would guess that there will be certain, there will be certain relationships, maybe not that one exactly, but there will be some around that eventually you'll be able to suss out and utilize because psychology and whatnot has already found like some of those. So I can't imagine that like that's the end of it. There's no more to be had.
And I think, as Price was saying, they're going to be able to bring in data from that they already have on you from your devices and your location and blah blah blah, right? Like people already have a huge stack of data being collected on them from smartphones and other sources. And then you add on top of that like granular health data. And then you have that for large populations. And then you start to see patterns, right? That's where I think you're going to, smart people and combined with powerful AI are going to be able to pull out patterns that were just impossible to spot before. And you'll see interesting things like, certain, I'm sure in the next 10, 20 years, we're going to see like certain geographies have like this pattern of cancer or whatever.
Mm-hmm.
Like, that's already been noticed without this crazy technology, but you're going to see even like more fine-grained patterns like that coming out where it's like certain diseases will be, and I'm sure like environmental pollutants will be caught by this and blah, blah, blah. Like there's going to be a ton of implications for this if they, if you get mass adoption. And I think that's like another thing to mention is this also benefits greatly from like the network effect, right? Like the more people that utilize your service, the more useful your service is. And I think like it stays true for these health devices because then you have like a bigger population to compare against. And the obvious one is DNA. Like the DNA ones just become they need comparisons to be meaningful at all, and the more comparisons you have, the better. So that's like the most clear cut case of like a network effect with these types of devices or interventions. But all the other ones, I think you can make the case that they benefit to a degree from the network effect.
I think it's also interesting to point out that the adoption of wearables is seemingly exponential in the same sort of fashion that, say, the adoption of the mobile phone was, or the adoption of the internet, in that we're already around 50% of people, well, 50% of Americans owning a wearable, somewhere around that number, and about half of them actually use it, which is a huge shift from effectively 10 years ago when wearables barely existed, or 15 years ago when they didn't. So, like, this sort of rapid adoption that will then lead into having more data to do more analysis seems to be the logical assumption right now that is going to happen, based on the rate at which wearables are being adopted.
I think that's worth noting, is that it's not like we're waiting for some like magical moment where a bunch of people get wearables. That already happened, right?
Yeah,
Yeah.
like half my coworkers have an Apple Watch. Or
The Apple Watch seemed to be like the bellwether. You see, ever since that, you've just seen people genuinely using their wearables on a daily basis.
And just like having them on, right? Like, again, my personal experience is the same. Like, of the wearables that I see out in the wild, it's probably 90% Apple Watches. And for whatever reason, people, and that's the other thing too, is like, it doesn't matter why people initially adopted them and used them. The It all comes along for the ride, right? Like, if you bought your Apple Watch because you want text notifications on your wrist, rather than in your phone pocket or whatever, it doesn't matter. You're still getting the heart rate functionality and the all that other stuff along with it. So I think it's interesting that they didn't need to use the health angle to sell wearables. At least most people I know didn't get it for that. They got it for like the Apple cool factor and the Apple phone, but on my wrist. Therefore,
the signaling.
It's like Star Trek.
well, I honestly don't really know what people do, but it seems like they like check their notifications, I guess, is the main
Well,
thing.
so Apple Watch, you can even get a SIM card in it, so it no longer has to be directly paired to your phone, which is way more convenient for a lot of people. And then you have the NFC payments, so a lot of people just tap their Apple Watch to pay at stores,
Oh,
especially in Canada.
That's true, especially as Canadians. Yeah, that's big brain is just using your Apple Watch as your wallet as well. That's
So
actually
it really is almost like a one unit everyday carry. You don't technically need your phone because you can pick up your texts or your phone calls off your Apple Watch if it has a SIM card, and you don't technically need your wallet because you can pay with it. Although if you are driving, you should have your ID. BC, British Columbia, has developed an app that has your driver's license on it now. I'm not sure if that works on Apple Watch, but that's the real ticket. Then you truly just only leave the house with your Apple Watch on.
I was gonna say, like, for the COVID passport stuff in Canada, a lot of them were just QR codes, right? That
Yeah.
would be scanned and brought up on the scanner, right? You didn't. So as long as it can display a QR code, I imagine the future will be that you can have a lot of identification on your phone, or sorry, on your phone and on your watch, right? And you just need a QR code scannable done. Like, it's not a far leap to see a bunch of different jurisdictions adopting, QR codes for driver's license and health cards and whatever else. Which, I don't know. We'll see. We'll see how well received that is. I don't know.
Yeah, probably it's many circles terribly well received, but among the general public, I think people are ready for it.
I think yeah. Obviously, as long as nobody pushes to make it the only option, it'll be very popular because the people that want it for convenience sake will, adopt it, and people that don't care and never want to touch it in their life will just keep getting the cards, and it's not a huge deal for them. So, but again, I guess the main point there was that there's all sorts of these other convenience factors that people are buying watches for, and then Apple's just finding ways to add more and more health functionality along the way, and then people take advantage of it when they already have it. They don't need to sell it just on the health functionality alone, which,
And I know we're focused on consumers, but it is interesting to note that this is all part of Apple's plan to then have greater control over health information and kind of work their way into the healthcare system, which is incredibly lucrative through that angle. Like working with hospitals to have all the patient's data stored on the patient's phone. I believe Switzerland, it was a European country, has actually made it legally required that a patient can have access to their data. And it seems like a lot of countries are going that way. So that Apple will be like, well, with our iPhone, your hospital can just upload all the data onto it, and then we can supplement it and talk back to the hospital too with all the data we're getting off their watch, as long as they click OK.
well, that does bring up an just a further point. A lot of these, say the blood testing one, you can provide the results from them to your doctor, and vice versa. You can upload your doctor requisition blood tests or whatever to your app, and that counts as another data point, right? So there is some like back and forth data that, so the doctor gets extra data from the app, and you get extra data from your, regular scheduled blood tests or whatever, which makes sense, right? Like having that functionality from the get-go makes a ton of sense. And I'm sure, yes, Apple would love to weasel their way into the medical system.
And I guess in the same vein, there's this convenience factor we're talking about. And another thing that may begin pushing wearables into the market from a top-down perspective would be prescription wearables. Because right now there are a few insurance companies in the United States that are giving out wearables on the basis of their existing health benefits in order to try and keep their insurees healthy and therefore not costing them as much money. But it's coming down the pipe that wearables will, once vetted by the FDA, which I don't believe any are so thoroughly vetted yet, will be able to be prescribed to monitor chronic conditions. Oh, I guess you could say the blood glucose is an example of that. The blood glucose monitors, those are obviously by prescription. But for a more broad demographic, it'll become more common to prescribe wearables for health conditions.
Yeah, I think that transitions into kind of one of the last segments, at least for me, was like the implications for healthcare in general. I think you will see a lot of effort by, I think insurance companies are the most incentivized to get these things, because it's all about preventative medicine with wearables. Catching the cancer before it's even started, getting people active before they're unhealthy, getting people eating right, letting them know of their risk factors genetically or with their physiology, with their blood tests, et cetera, et cetera. And that's just good for the insurance bottom line.
Mm-hmm.
When you come to Canada, I think that's another interesting factor, because you'd think like in Canada, where basically the government is the insurance company for everyone, there'd be a huge push to get this stuff moving as fast as possible. That doesn't seem to be the case whatsoever. I don't know, like a lot of the stuff I see because I see kind of active people in the fitness community and that kind of thing already using this stuff in the States, and some of them can get it at prescription on like a preventative case. Like there's people I've seen that have gotten continuous glucose monitors prescribed to them despite not being diabetic in the US, just as like a thing to better monitor their health, right? Their general health. And their insurance is paying a good chunk of the cost of that, right? And I'm sure the insurance company sees it as just a cost-saving feature for them, because future health outcomes.
Yeah, $1,000 now versus like $40,000 for treatment 20 years from now.
And I haven't seen a whiff about it in Canada, which is, I think, disappointing, both as like a
But also
Canadian
par
who,
for the course.
yeah, would like to use these things, but also as a Canadian who pays taxes and would like our healthcare system to be
Efficient.
efficient at like do one thing right
Well,
at some point.
I think I could have a snarky comment or I could try to have a normal comment, but the snarky comment is obviously they're just going the MAID, medical assistance in dying route. That's how they're going to cut costs. But I think
The only wearables that the Canadian government will prescribe you are just negative self-talk wearables. Anytime you experience something good, they remind you how terrible your life is until you subscribe to MAID.
it's just,
The only
the
wearable
the only
though,
guns that are actually now permitted in Canada are the ones that government issues, so you can off yourself.
you can get a unlimited gun licenses if you promise to shoot yourself with it.
Yeah, America's now putting a ban on people owning guns if they feel like they have mental health problems. Canada's promoting it. It's going to happen.
The red flag laws have a suicide exception.
Yeah.
Oh no, he's gonna kill himself. Okay,
thank
keep the
God.
gun out of his place
Yeah.
for sure.
Could you?
He's not
could
a
you
risk
go,
to the community.
Could you go check
Oh,
in
he's
to
gonna
make sure
shoot
he's
up an
done it?
old folks home. Okay, never mind. We don't want to hear. You can keep the guns.
In case anybody's totally out of the loop, but I feel like this has been the butt of many jokes about Canada in recent weeks. MAID, medical assistance in dying, recently became our third leading cause of death in Canada. And as 11,000 in 2021? 11,000 people were euthanized.
Yeah, I saw for sure over 10,000 because that was the headline.
Yeah.
And the way it's being issued basically by the government is medical staff are suggesting people who, they need a wheelchair ramp. Well, you can't have that. You should just kill yourself.
To be fair, that wasn't a medical staff. That was a Veterans Affairs.
Oh, Veterans Affairs. Yeah, sorry.
A Veteran Affairs like bureaucrat, and the veteran was writing them saying, "Listen, guys, you're my advocates. Can you please advocate for a wheelchair ramp for my house because I want to access my own house?" And they
This
said,
is a Paralympian too, by the way.
Have you considered killing yourself?
Yeah. In Canada, that's
the
your
person
reward for
said,
being a Paralympic athlete. We suggest that you kill yourself.
In every other country with medically assisted dying, it's illegal to suggest to someone that they take that option. It's an option that's there for them, but you can't suggest it. In Canada, yeah, you just go ahead. Anybody can suggest it.
Yeah, the crazy thing is,
Everybody should suggest it. Sounds
the
like.
medical employees have been suggesting it. There's been several scandals about doctors and nurses putting it on the table to various patients, some of which have had very questionable conditions to justify suicide. And then, yes, then you have bureaucrats in other parts of the government who have no medical background or training or involvement telling people that as an option to get their bureaucratic problems solved.
That is literally late stage bureaucracy right there. Just
I can't wait to respond. I can't wait to respond to a client of mine with that. Oh, yeah, oh, buddy, yeah, you want to get that exported out? Have you ever considered killing yourself? Your duties were too high there, buddy. Have you ever considered killing yourself?
At some point, our bureaucracy will get so bad, people will just start taking that option. Like, okay, I've been stuck in this bureaucratic.
Just link them the MAID page every time. Oh, you want information on how our government programs work? Oh, here's the MAID page.
It's just 50% of the government is devoted to MAID. Canada's population starts dropping rapidly.
But
Yeah,
on a more serious note, I do think like it would be like in Canada's wheelhouse for sure if we would get on this and try to prevent some future medical costs with preventative medicine.
My serious point there was that I think that Canada has, at least decent parts of the medical profession have gotten themselves kind of stuck in a weird spot for some reason. There was a large cohort of doctors in Canada saying that obesity, like they signed a big open letter, and these are some of the leading doctors in the field, saying that obesity, you shouldn't bring up obesity to patients because it's mean, and it's not, and obesity only impacts health if the patient says it impacts their health. Like you shouldn't be pushing it upon them to say that they're overweight and they need to deal with it, because it really only is a problem if the patient themselves thinks it's a problem, which is obviously insanity. So I do think that our medical system has, in some ways, gotten itself into some backwards, truly, and the MAID is a great example of that. It really has put itself into some backwards thinking situations, and like for these types of devices and preventative care, I just, if we're going ahead and doing certain things that we're doing right now, trying to think about like things logically for a big chunk of our medical profession it's just not going to happen until like something changes. It's very strange, but that does seem to be the place that we're at.
I think as long as the incentive's there, it will happen. I'm no expert on the intricacies of our medical system, but I imagine a big chunk of it will come down to how the practitioners get paid, right? And you see that again in the US, you have insurance. I think the reason the US is kind of on the cutting edge is because the insurance model puts the incentive, the monetary incentive, into actually providing these types of devices to people for the insurance companies. So they go and push them onto the practitioners, get them prescribed. In Canada, we don't have we don't have that middleman private insurance company that's profit driven. We have the government backstopping everything, and that leaves your like level of market participant with an actual incentive being your practitioners, your doctors. And they, as far as I understand, get paid basically by the number of visits and procedures essentially.
Which was good for telehealth during COVID, and then the provinces have started going back towards paying less for telehealth visits.
Yeah, so I do think there will be this weird incentive to maybe not put a lot of effort into these things from a doctor's perspective, because I think I think in Canada it'll be a little bit more idiosyncratic, where it'll be what gets continued business and easy and quick visits into the doctor's office, right?
Well, and I actually think that these devices, depending on how they're used, can actually speed that process up, right? You could get more patients through if you're able to pull a bunch of the data from the device. You don't have to worry about doing certain things. It's already there. It's like, okay, instead of doing a 30-minute visit, you get it down to 15 minutes. Well, you can double your throughput.
A 30-minute visit with a doctor in Canada? Are you a millionaire?
Well, that's a 30-minute actually.
A 30-minute visit. What he means by that is you double your time from speaking to the doctor from 2.5 minutes to 5.
And the rest is...
And you also double your time of sitting in the appointment room with no doctor and just twiddling your thumbs, looking like a jackass. You double that time from 12.5 to 25 minutes. That's what I meant.
Yeah, that sounds about right for Canada.
Again, I think it will be a little bit interesting because certain geographies will probably utilize it more because they have more doctors, and therefore maybe they want to do a little bit more kind of peripheral preventative stuff because they don't have they're not at capacity, although that doesn't describe very many places in Canada. And then other places that are just like totally overburdened with like basic care and are backed up the yin yang, which is most of Canada, to be fair, may just not have like the incentive or time to deal with like an extra layer of preventative stuff, or kind of what they see as non-essential,
Yeah, it's just keeping the
non-life-saving
ship
stuff.
afloat, right? Even though in the
Well,
long run this would be much better.
yeah, it's like they've got emergencies to deal with. They're not going to put those off for, yeah, non-emergencies, and they just don't have, like, if you're backed up the yin yang with patients, you have as much work and as much money as you could ever handle as a doctor, right? Like, there's just no incentive to bring on more business because you have an unlimited amount of business demand already. Again, which is part of the problem in Canada, right? Like, is because there's no uh, there's no cost for Canadians in terms of upfront. It's just all through taxes. Given individual Canadian has no restraint on like visiting the doctor. So demand for doctors is always just, well, medical services in general in Canada are just through the roof, way higher than supply could ever meet. No matter how high our supply of medical service goes, the demand will always gobble it all up because there's no cost to the individual, which
I
is
think
not a great way to go.
from what I've seen with regards to sort of how the Canadian system works, my suspicion is that Canada will simply lag the United States by years, maybe a decade on the wearable stuff, but that the United States will end up pushing it so hard that the big players get involved. And it's already sort of happening in the sense that some of the big pharmaceutical manufacturers are looking at partnering or working with wearables or software health companies. They're seeing the writing on the wall in the next decade in America, and that once they start adopting these things, they're going to push them in Canada the same way they would push their regular drugs in Canada because they've invested in it for America. And I think that's, like, just pragmatically to me seems like the impetus that Canada will actually take to follow in the wearable health trend from a healthcare perspective.
I think that's a good possibility and a hopeful one. Like, to be fair, how well that will be implemented, if it's the big pharma companies, kind of peddling it into Canada, I don't know. Like, they might be a little bit too aggressive with it, but at the same time, if it's what gets, if what gets the whole movement in Canada going, maybe it's for the best that there's that pressure, because, yeah, again, I don't see a lot of hope for the Canadian medical system doing it on their own merits. Although I do find it interesting, completely different field, but Canada's like always been a decade or more ahead of Americans in like technology for banking. You hear about some of the horror stories out of America on like their savage ways in terms of how they bank. And you're just like, what fucking decade are you guys in?
Yeah, having to rely on PayPal feels bad.
Well, yeah, it's so funny. People complain like Canadians don't have Venmo. It's like, we don't need it because we're not animals. Like, just like, why would you want Venmo or Cash App? Like, Jesus Christ! Like,
Yeah, no, they're still
Have you
going.
heard the good word of e-transfer?
exactly. It's like we've had free electronic transfers for decade plus without the need for some sketchy, shitty third-party garbage. Like, oh my god. But I don't know. Like, maybe that parallel is just not there whatsoever. But I do think it is interesting that we have one industry that is leaps and bounds ahead of Americans in terms of tech.
I think that's just the
And
incentives, like the way it's structured, right?
yeah, I mean,
That'd be my guess, is just that and regulations.
Canadians do have quite a bit of Canadians have quite a bit of technology, and Canadians have adopted like smartphones and all those kinds of things very rapidly. So Canadians might not be that far behind the curve on just like having access and wearables, right? They, I actually didn't see the numbers, but it's possible that Canadians are already ahead of Americans in terms of like Apple Watch ownership and shit like that. So they
Yeah,
might
that
just
wouldn't surprise me.
Yeah, it's just more the fact that getting the Canadian medical system to buy into it is a totally different story.
It's true, but it could certainly help that Canadians would already have, the wearables and stuff and already be getting the data themselves. And if they see Americans integrating that with their medical system, and Canadians are like, well, I already have an Apple Watch and I already collect all this data, like why can't it be integrated with my, my medical health, and why can't my doctor get access to this, and why can't I use this in my doctor's visits, et cetera, et cetera. If they already have all that stuff, already being collected and they already have the equipment, it might just have the political will to kind of get instituted into the Canadian medical system faster.
Yeah, it seems possible, although it just feels a little optimistic. But Canada is good at adopting tech on an individual basis.
And we're also good at observing Americans and then bitching and whining when we don't have things that they have.
Oh, yes.
It's a favorite
That could help.
pastime. I bitch and whine about not having Trader Joe's.
I guess that's the one thing, that's a real possibility that will matter more than anything we've talked about yet, is that the Canadian sense of identity is tied to superiority to Americans, and the healthcare debacle that's currently ongoing starting to erode that sense of superiority. So something might actually come out of that erosion. There might be an insistence for something to be done.
Mandatory made.
And I would say a good chunk of the superiority has always revolved around healthcare specifically.
Yeah.
Yeah,
Totally.
that's been the cornerstone of our superiority complex.
Exactly. So it's like the key, the key cornerstone of our smugness is, oh, we have quote unquote free healthcare. Yeah, we're so impressive.
Yeah, then once
Then-
they actually start making any sort of money that's not just poverty wages, and you're like, oh fuck, I'm just getting railed on taxes here. Wait, it's not free.
For me, it's not the taxes. I like taxes kind of suck. I'll admit. I just wish our healthcare was better.
Man,
Yeah.
I'd say, yeah, exactly. Trying to get a specialist is like 6 months sometimes. The last time I went, it was 6 months. I was like, what are you
No,
talking
the real
about?
horror story is the people who get a probable cancer diagnosis and then have to wait 6 months to get that probable diagnosis confirmed.
Yeah, that's
If the
absolute-
cancer is literally growing inside you for 6 months while you wait for something to be opened up.
I think just if you have a cancer diagnosis and you can afford it, just go to the States immediately.
Well, that's part of the problem. I mean, we've discussed it before, or I don't know if we've discussed it on this podcast, but I think part of the problem in Canada with our healthcare system is that it's really shitty just for the middle class. Like if you're an elite, like if you're a Canadian and you're in the top like 1% to 5%, you just go for medical tourism if you're not happy with the level of service.
Yeah, you just go to the States or Europe.
And if you're poor, well then your medical, like your coverage is compared to poor people in say the US, your coverage is just subjectively better. But if you're in like the middle 80%, you just have shittier healthcare than say America. Like I would say the middle, maybe it's only 60 or the middle 60 or 70% of Americans have better healthcare than the middle 60-70% of Canadians. It's just the bottom 15% of Canadians or whatever, and the bottom 15% of Americans, Canada has it better. That's true. But it's like, if you're not part of that bottom 15%, what is it? Like, it's not a big selling point that your healthcare is actually worse. So, I don't know. And if you're an elite Canadian, then it doesn't matter to you because you're going to go to America for your healthcare treatments anyway. Like, it's just... So the middle
Or
class,
at least
is the one
Mexico.
yeah, like the middle class
Well, you
is the
go
one
see
that
an
gets
American who
screwed.
has a clinic in Mexico.
Yeah, that's where you get the good
brain.
deals.
Yeah.
He's like, this surgery is not FDA approved, but they're just holding me back from greatness. So I'll give it to you for a good price.
Hey, honestly, that exact thing saved a family friend of ours. It's non-FDA
Yeah,
approved
it
cancer
genuinely
treatment, and
happens.
it was stage 4 terminal cancer, and was like what, something 90%, 90 something percent fatality rate, and went to Mexico and actually beat it. I was like, holy fuck. Gonna go to that.
Get a lot
doctor
of
if I get
maverick
cancer
doctors
like
in
that.
Mexico.
Well, and see, it's like again, those are people that are like in not even elite, but upper middle class.
Yeah,
If
yeah,
you're
both of them made good
middle
money their
class
whole
and
lives.
you've been reasonable with your savings, you can afford medical tourism, and then you just get the fuck out of Canada and get actual medical care.
I know. That's why I'm just trying to make as much money as possible for the inevitable breakdown of my body, given my shit genetics. Gonna have a lot of tourism.
And yeah,
Or
Thai
maybe I'll just
tourism.
take the maid route. Who knows?
Do we have any other
Did we get to
random?
cover like the downsides of the wearables?
I didn't feel like we could just sort of run over
Yeah,
a
because
few
there's a
because
few I
one
thought we hadn't really touched on that I thought would probably be good to discuss a bit more.
one really obvious segue from what I was talking about the institutions and dealing with wearables. And I mean, you look at Canada, and you can just imagine what our level of digital security is for our healthcare systems. It's probably not much. So you start trying to integrate these wearables into the healthcare system, and then you need to have devices outside the secure networks communicating with the secure networks. And it just opens a whole can of worms in terms of data
Yes.
privacy.
You can have your Apple Watch, you just have to fax us the data.
Yeah, exactly.
Like that, but unironically. Half the medical system still runs on fucking fax.
But it's because
Crazy.
they don't have the digital security that they view as sufficient, so they're still using fax. So then it's like, well, how do we expect them to adapt to a future with wearables and talking back and forth to iPhones? You could see a lot of problems potentially coming down the pipe.
Yeah.
Yeah, I think that is a downside for sure. We also did cover the downside of just people having too much information, not really knowing what to do with it. I think that's clearly going to be
Yeah.
an issue for many people. And kind of like an additional related fact is people obsessing over said data, right? Like now they have all this activity information about how many steps they're getting.
Start
and-
optimizing for the wrong things.
Or just like, yeah, or just like
An
going
addiction,
to
basically.
yeah, basically, right? Like obsessing over it to the point of unhealthy obsession, and maybe their physical health is unaffected or even improved, but their mental health is, decreased because they're trying to min max,
Waking up at midnight to get their steps in.
yeah, just doing weird things and just continually preoccupied with, a metric that at the end of the day is not that important, right? So I could definitely see a chunk of the population that gets an unhealthy relationship with many of these devices.
Yeah.
And then there's, I guess, also the basic level that a lot of the data isn't, well, none of the data is perfect, but a lot of the data is not even good from these sensors yet, but they still provide it, such that even taking reasonable actions based on the data could not result in any positive benefit and could result in negative outcomes.
Yeah, because the data is actually flawed. So you're doing something that you shouldn't have been doing.
Most egregious example I've seen, but the studies were from 2019 and 2020, so they could be better now, is the sleep information that is provided is effectively useless. Although, in their defense, there's effectively no useful way to get sleep information without sleeping in a laboratory. And obviously, sleeping in a laboratory usually decreases people's quality of sleep in the first place. So that is already flawed to begin with, but the implication that you're getting good sleep data is incorrect if you have wearables, as far as I could tell.
I think that's a good point, is because a lot of this is outside of the medical, like the actual medical establishment. It's not going through rigorous approvals. It's not going through rigorous testing. You're kind of just left at your own devices to figure out how useful the information actually is and whether it's reliable and whether it's even informative. And to go along with that, I think the obvious problem that brings about is like scams. You're gonna have a tremendous amount of just bullshit in the space because it's lucrative. There's lots of money to be made. It's not heavily regulated if you don't go through like actual medical approval. And
Yeah, you're just buying like a
yeah,
Fitbit type
it's just
thing.
you could just feed, you could see plenty of companies coming up with, essentially meaningless measurements that they feed you. You could just see a company coming up with like a band that displays a random fucking number, right? And your brain placebo.
Oh, like the mood rings when we were kids.
Yeah.
Yeah, basically like the tech version of crystals, right? Like, oh, I have this band and it gives me a readout every minute and it shows me this number and this number is correlated to this. And then if I just do these 5 things, then the number changes. And in reality, the number is like either completely random or just like not
Yeah, it's just like showing
not
like the
linked to what
average.
you're actually talking about. And then you're just chasing your own tail, and the company sells you on a $300 bracelet that doesn't do anything. And I could definitely see a lot of bullshit in the space. I think we saw the first Theranos or whatever her name was.
Yeah.
Elizabeth Holmes of Theranos.
Theranos. Like, she was just an out and out fraud, which obviously at least she got jail time. But I could see people that are like skirting the line where they're basically
You
they
just
keep
put
their
in
claims.
sub-quality components and measurements, right? Or like measurement tools where it's just really not going to do anything useful, but it's not technically fraud.
Yeah, you moderate your claims, you caveat it, you get your lawyers to go through things so you're not actually fraudulent, and then you just release a bunch of bullshit that doesn't actually do anything for anyone's health, and
For
you sell a bunch.
instance, I would not be surprised at the impetus behind the sleep monitors being almost ubiquitous now is that somebody did sleep monitoring and it wasn't effective. And everyone else is like, well, we can do sleep monitoring that's that bad. And they just all included it. That's the sort of thing I imagine is going to be relatively common as people come up with advancements that are not super effective. Like, well, I mean, I could do that. I could put that on my feature list.
Well, and maybe not even I could. It might come to the point where it's like I have to, like we have to have it on our feature list. Otherwise, people are going to shy away from our device because we didn't slap, sleep monitor on the side along with everything else.
Yeah, actually, that's probably more accurate phrasing of it because you're going to lose market if you don't have it because people will just look up, oh, what does this device do?
Yeah, and it's like even if the engineers know that it doesn't actually have any predictive power on your sleep, they're going to slap it on there so that their feature set doesn't appear any worse, right? And yeah, I could definitely see that happening, and every single company just having to race to the bottom essentially, right? Like that would be it, like where a company just gets like the most minimal viable feature working for whatever, and then every other company follows suit, slaps together some bullshit version just so that their product can have it on the box too.
Then there's I predict there'll be a big wave of sort of metadata, like taking the data they already have and then saying what it means and interpreting it in certain ways. I bet that'll become a big thing in the near future. Possibly even like a software market there. You download an app and it takes your input from your Apple Watch and now it tells you, I don't know what it would tell you, something complicated that sounds scientific but has little to no basis.
Right, you mean like scams based around like interpreting data.
Yeah,
Analytic scams, yeah, that'd be a huge market too, because that'd be even more wishy-washy. Where it's
because
just
you'd
like,
get one study in Norway on 15 people that found, oh, if you take heart rate and blood oxygen level, you can predict sexual performance. And then you'd be like, here's the sexual performance app, $9.99 a month.
yeah, feed your Apple analytics into our
It's going to be like the
software.
Unity games, but for analytics, for biomedical analytics. Slap together something in a weekend, throw it on the App Store.
Yeah, so yeah, that's definitely a avenue for bullshit, right? And just,
One of the other downsides I kind of see to this is, like it's just the same thing with like data and privacy in general, is especially if it starts becoming more and more integrated with the government systems. Like it's quite a bit of sensitive information that you would be then granting over to the government or to the medical system at large. And depending on where you are, that could be easily abused by people with like bad intentions, like whether they're government or even corporation, right? Like corporations like taking the data, using it to, upsell you on shit.
I'm thinking more dystopian. We no longer need to discriminate by race. We can now discriminate by allele.
Yeah.
It's like, I'm sorry, but if you have this allele, you're a subhuman and must die. Just don't know how else to break it to you.
well, I think I'm not worried about like the particulars, that worry of like say governments or hospitals or whatever having that kind of data, because they already did. Like they know what the inside of your colon looks like. I don't know how like much more private data they like a hospital can really collect. So I would be more worried about corporations for sure. And I think the problem with like governments abusing data won't come, like they might abuse it, but like the reason that they start abusing medical data won't be because of this stuff. I don't think. I think governments are already like looking towards abusing data, but that's for other reasons, and they might throw in medical data on top of that. But like,
Cherry on top.
yeah, but they already have like heaps and heaps and heaps of private medical data that they could go to, abuse if they wanted to, if they started grabbing your medical data, right? Like people's medical data is already with the hospitals, and it's already like as about private as you can fucking get. Like it's not like they're going to get much more private than what they already have. So I don't know. I just don't see it as like a qualitative change in the level of intimate data that I would say corporations are getting access to.
Yeah, that would be my primary
Qualitative
concern,
change.
is just like the ability for corporations to start gathering all of your super private medical data and then just, start using it to upsell you on more shit.
Because yeah, I think you can make a pretty good argument that this would be like the most intimate data that corporations will have access to essentially. I mean, it's probably debatable, but I think there's a good
Yeah, it's
argument to be
pretty,
made for it.
I would say, I would be of that opinion that it's the most private, but
So definitely worth keeping an eye on.
yeah. Well,
Is
you guys have anything else?
I think that about does it for me.
Yeah, I'd say so.
All right. Well, thanks for listening, everybody. Peace.
Peace.
Peace.